I said before, we believe in health and psychology that mental health is a human right, and yet the situation is in Tunisia today is complex. Mental health is affected by multiple social, economic, culture, political pressures, current challenges as inflation, employment, and instability contribute to increase stress for many people. At the same time, Tunisians are constantly exposed to distressing global news, including wars and humanitarian crises. This exposure can lead to vicarious trauma, where people experience emotional distress simply by witnessing or hearing about the suffer of other people. So, and studies confirm this reality. For example, 2021 study found that over 70% of Tunisians reported symptoms of anxiety and depression during the COVID-19 pandemic. Hospitals such as Rasi Psychiatric Hospital are often overwhelmed, and public mental health services remain unevenly distributed or concentrated mainly in Tunis and coastal areas. So overall, the level of psychological distress is very high, while the capacity of the system to respond remains limited.
So that's what is really worrying for us. I mean, here, plenty of people, society today are more and more stressed, more and more worrying, anxious, suffering from anxiety, but still, let's say the services are not enough in Tunisia. And the focus, you said, it is on the Sahel region, the coastal region, and the capital. That's the most.
Voilà.
So what we can understand is that the vulnerable people, those in inland areas, are still not benefiting from the services of mental health professionals.
Yes, and they are facing difficulty and to access to the care, to the mental health care.
So they have difficulty. So yes, we can understand, because actually hospitals in inland areas, they are just having some specialties, not all of them are present. So concerning the health troubles and emotional troubles that Tunisians are going through, can you tell me, according to your expertise, according to experts in the association, what are the most worrying mental troubles that Tunisians suffer from?
They are suffering from, as I said, anxiety and depression, and especially we work a lot with the children and their parents. So, and being a child is so vulnerable in this society. So we see increasing cases of school refusal, attention difficulties, behavioral problems, and the signs of trauma, especially among those facing family conflicts or instability. In our center, we have observed that stable emotional care, constant attention, affection, and routines can significantly improve a child's emotional, cognitive development and resilience. And among adults and young adults, there is burnout, emotional exhaustion, psychosomatic complaints, are also rising, especially among those struggling with employment and instability. So this phenomena indicate that we are growing to a collective distress that needs attention from both families and the broader mental health system.
Exactly. So what we can understand, that children themselves are suffering, and that's even at a very, very young age.
When the parents are suffering and their peers, like their friends, are suffering, so I could say automatically that children
they are impacted by that.
Yes.
Yeah, and we can understand, especially those who are going through hardship in their relationship, parents who are going to divorce or something like that. That's a direct impact on children, and we can witness that even in our surrounding, I mean, among people who are surrounding us. So children are the first victims of being violence in the home, or abusing fathers or mothers,
And even neglecting
neglection also.
Yes.
And even neglecting parents, it can impact on the children, because children, they need affection, they need love, they need to be surrounded in order to grow into a very balanced adults. But not only children, as you said, is even adults, they go through hardships, especially people who go, I mean, young people who go through exams. They are really, they can experience burnout, as you said. Unemployed also, unemployed people, even though this category, I suppose, they are suffering a lot because the fact of not fulfilling their dreams, working hard so much in order to reach your objectives, and finally you find yourself jobless. Even can you imagine yourself after the baccalaureate exam, national exam, you still go for a long period of joblessness? That's really hard for them.
Yes.
So yeah, it's very interesting to learn about that. So what about treatments and therapies? Are they possible? Are they available in Tunisia? Is it possible for every Tunisian citizen to have access to medical care?
Medical care as drugs, they are available with the psychiatric therapy, but as we said, that psychiatrics are not available in all
the regions.
Voilà. Yes.
Yeah.
And for psychology, we work through a long time, or through a long period of time, and we are in period that everyone is in a rush. So having continued treatment with a psychologist is so hard.
I suppose it's a long treatment generally.
Yes.
And it's not like a flu or a problem with the stomach, or
Yes.
I mean, you take your medication and that's okay.
Yes.
So
And with medication, it's not the finished treatment. This is just for reducing symptoms. To the psychologist could do this work. So, for example, psychiatric without a psychologist is not. It's complementary jobs.
You need therapy. You need to have your session with a psychologist, but also these medication are just simple added things in order to reduce a little bit your symptoms, as you said.
And to increase or decrease the level of the medication, we should consult. To do the consultation with your your doctor.
Exactly.
Do not do it.
Take it as you like. Your self-medication is a very bad habit among Tunisians. They like self-medication. Concerning now the association itself, you said that you are working on a psychosocial integration of patients. You are trying to solve some of the mental and emotional issues. So can you tell us a little bit about your projects and the programs that you are working on?
Yes. We work through several projects and with a partnership also with some institutions.
Public institutions?
Yes. For example, we work a project called Sanad. It's a project in partnership with the Ministry of Social Affairs that supports children without family support. Family support.
Yeah.
And this by provide them a home with caregivers and live a normal life as possible.
Yeah, yeah.
And
so you collaborate lots with orphans and associations like
yes,
that.
To reinforce the idea of
Disinstitutions.
Yes,
okay.
of children. And also another big project in association, it's called IDMAJ, and it dedicated to children in schools and partnership with the Ministry of Education. It helps those face difficulties adapting to the school system through neuropsychologist evaluation and by providing recommendation to the educational team to ensure the children's right to education. And through these projects, we also organize parents groups to discuss challenges about the function of being a parent and to address issues like parental burnout. On the other hand, we conduct sessions of sensibilization for educational teams like teacher and directors and everybody who work with children to raise awareness about neurodevelopment disorders and learning disabilities and provide practical recommendation to support these students. And currently we are working on the project called Petit Pas, خطوات, aimed as preventing disabilities in early childhood with intervention in 3 cities, Tunis, Nabil and Medellin. As a part of this project, we have organized Café des Parents, sessions to raise awareness on relevant themes and support parents. And also, among these projects, we organize annual events. Like every November, we celebrate on 20 November, I think, the Children's Rights Day. So, we do workshops about human rights, children, arts. We do some activities with them, and to raise awareness about mental health as a human rights. For example, last year we held a public discussion at the Culturel Café, inviting young people to take part of in open and friendly conversation about the importance of mental health and emotional well-being. The goal was to make these discussions more accessible and to help reduce the stigma surrounding psychological issues. So our population, it's the normal people of every of the Tunisian people. And we hosted also an event in our center, combined art, music and psychology, highlighting how creative expression can play a powerful role in psychological healing and intervention. In addition, we collaborate on the last march with local and non-local association on a conference dedicated to resilience and schizophrenia. So we examine this topic from medical, psychological and social perspective. They are present. They are doctors, psychologists, and occupational therapists to talk about how we can treat people with schizophrenia in Tunisia. And this event highlight the importance of multidisciplinarity approach, bringing together psychiatrists, psychologists, and occupational therapists to provide more holistic and effective care.
So it seems that you are very active. Unfortunately, we didn't hear about the association, so we hope that to have you more on the media so that we can learn a little bit more about your activities. So for all those who want to have recommendations or who want to have an opinion about that, they can join you on the association, I mean, on the website of the association.
Yes, they can take rendezvous,
a
an appointment. By just calling us on the association. Yes.
And by the way, for all those who want to know a little bit more about the association, they have their Facebook page, I suppose Instagram also?
Yes, Instagram, Facebook, LinkedIn, and we have a website. That's
also. So for all those who are interested, you can learn a little bit more about all the activities about this. It is entitled Health and Psychology. It is very important. I really love the last point that she was speaking about. It's about art, including art in the therapy. That's one of the best ways of curing, especially when you are managing with children. Children, they cannot put them in a setting where you are addressing with a doctor questions and answers. You have to let them play and try to understand, let's say, indirectly all their suffering or their emotional instability or mental issues. So here it is. So there are plenty of interesting things that you can learn. Unfortunately, there are Tunisians who are conscious about the importance of mental health, but there are many people who go through the suffering alone, and they don't realize that there are people around them who can help. And here, I suppose the role of the family is very important.
Yes, very important. So if you notice any change of the comportment of the people who you love, just help them to seek help.
Yes.
That's it for a professional one to live.
To save him, at least from the first phases, so that he cannot reach from just for the first phases, first moments of instability, emotional instability. Don't let him go through that whole process until reaching depression.
Yes.
And depression, you know, curing depression is not easy stuff.
Yes.
We take it very easily. Oh, I'm depressed, but that's really a very serious malaise, actually.
Yes.
And it takes a long, long time to get cured, I suppose.
Yes.
So thank you so much, Lina Ghattasi, a specialist, a psychologist, neuropsychologist, and also a teacher. She's teaching at the university, so it's really important. For all those who are listening right now, mental health is a very important thing. And by the way, we celebrated the International Day of Mental Health on the 10th of October. So it's really important to take care of yourself and of the people around you, because as we said, there are plenty of issues that we can face, and people need help during these moments of downs. When they are happy, it's okay, but when they feel down, you have to check on them, to ask them, to encourage them and support them to go and see a psychologist. A long time ago, it was considered only crazy people go to the psychologist. I suppose this mentality has changed.
Yes, in the recent years, yes, we observed some changes, and stereotypes are disappearing more and more through about mental health and generally. But I would say that being also sad, it's not an illness.
Yes.
We should accept that a human being, and being a human, it's being vulnerable, and we have ups and downs.
Yes, I like this one. So being sad is not an illness, you know. So it's just a simple emotion you go through. So sad, happiness, moody probably. If someone is moody, that's a problem. So you change very quickly. So thank you so much, Lina. We learned so much. We hope to learn a little bit more, and we hope that we provided some of the your expertise to our listeners. So take good care of yourself. Don't let your emotion and let you down, your emotions down. Anxiety, depression, shock after trauma, all these are things that can be cured, but you have to consult a psychologist. Don't stay alone. Thank you.
Thank you.
I've been alone inside my mind.